it's Kayla, and today I wanted to officially kick off my Blind Mom series, even though I've made a few videos here and there, kind of the lead up of being an expecting mom, but now I'm actually a mom, and I felt like the most natural opener to really kicking off the series is to start from the beginning and talking about childbirth as a blind woman. So I wanted to share a bit about my birth story and then talk about some different kind of like facets of specifically relating to being a blind woman, giving birth and becoming a mom. I mean, there's not a whole lot to touch on there because childbirth is not really that visual of an experience, but there are a couple of things that I wanted to touch on. If you do not want to hear about childbirth or mild descriptions of like blood and stuff, I mean, I'm not going to get graphic, I promise, but just a heads up that those things will be discussed in this video. So as of now, I am 6 weeks postpartum, so the details of my experience aren't the most clear anymore because it was a while ago. I wanted to make this video when it was more fresh, but I've been busy wrangling my newborn baby. So I think I'll start kind of with what preceded the birth, which is my OB. So I really loved my OBGYN. I really trusted her. I trusted her recommendations. She was always very kind, very patient with answering questions. She was just all around super great, which is rare for me to feel that positively about a doctor because I've mentioned this in videos before, but I have a lot of health anxiety and medical anxiety that I have a hard time trusting doctors, but I trusted her fully. She was really great. But more importantly than that, or I don't know, more importantly, equally important as that is that I felt like she trusted me and my capabilities of being a blind mom. And I think that is super important, that I did not feel like she doubted me or questioned me. I think in the very beginning I sensed maybe a little bit of hesitancy from her, but I think it was maybe just because this was new. This was not something that she has never seen before, but it wasn't coming from like a really judgmental or condescending or negative place. It seemed like she was just unsure, but we had a very brief discussion, and then it seemed like she was good from there. She never doubted me again, and so I think it's really important to have that relationship where that trust goes both ways. And so I want to encourage any blind women out there who is expecting or is planning on having children to make sure you feel comfortable with your OB and that you feel like your OB feels comfortable with you becoming a mom. Because if you think that, oh, just any medical professional is going to doubt a blind parent, that's not true, and you don't have to settle for that. And same for a pediatrician. You do not want a pediatrician that's going to doubt your abilities of being a blind parent. And our pediatrician has been really great too. So I have been really happy with the providers that I've chosen. I did a lot of research before choosing them. I did not pick them willy-nilly, but I've been really pleased with that. And so just know that that is out there. And like I said, you don't have to settle for less. So in addition to my OBGYN, I also had a doula on my birth team. I didn't get a doula because of anything blindness related. I got a doula because I wanted to have a natural or an unmedicated childbirth, which I did accomplish. And I also, because of my medical anxiety, I have done a lot of research on how having a doula can really help minimize interventions, help minimize the risk of C-section, which I was terrified of. That was like my number one goal, was to avoid having a C-section. And, having a doula also, there's a lot of research that people just have a lot more of a positive birth experience. And so, since it was something that I was so scared of and had so much anxiety about, I really wanted that extra support. And I think the doula was helpful in a blind related fashion because she was able to help me get into the different like labor positions, which I wasn't able to see from like pictures or demonstrations. And so she was able to describe those to me and help me get into those positions. Otherwise, I don't know that there was anything blind specific that the doula was helpful with, but I still highly recommend having a doula if that's something that you think that you might want, or if that's something that you can afford, because it is pricey. It is a privilege to be able to have a doula. But she was really helpful just to have someone that I could ask questions to. I think I hired her around when I was like 20 weeks. So I was able to keep in touch with her for her to answer any questions that I had, go over birth plan, think things through, help me get ready, help teach me some of the positions for early labor before my due date. And then during, she was able, like I said, to help me get into the labor positions. I really just wanted someone there that was an extra support, that was really informed about my options and the process, so she could help me like if there were any decisions that I needed to make on the spot or something like that. I just really wanted that support. That didn't happen. I had a pretty straightforward birth, but I still was really glad that she was there. And she just helped with other like pain management techniques. She did like these counter pressure points. I'm not even sure what all she was doing, but whatever she was doing, I think was really helpful. And of course, she was just like mentally, emotionally encouraging. So it was good to have her alongside Ethan, who, he was great the whole time, but always good to have some extra support. So, on to my birth story. So, I went in for an induction the day before my due date, which I really did not want an induction. I wanted it to happen as naturally as possible. But since I had double risk factors of having gestational diabetes and having an IVF pregnancy, my doctor did recommend not going past my due date. And so I trusted her recommendation. I wanted to do whatever was going to be the safest for my baby. So I went in for my induction at 5 a.m. and I was surprisingly not as anxious as I thought I would be. I felt relatively okay. I mean, of course, I was anxious, but it was functional. So went in at 5 a.m. They got me like hooked up to the monitors, and well, actually, first I'll say the nurse that was there for the, I don't know what they call it, like the just the beginning part, orientation, I don't know. She like helped me get all set up, but then she left. But she was really great. She showed me around the room. She was like she walked me around so I could get oriented. Here's the bed, here's where the bathroom is, here's where the labor tub is, here's the step, here's this. I think she too, when she was like putting the monitor on me, she had me feel it before she put it on me. She was fantastic. She was very thorough in reading me all of the consent forms that I had to sign and everything like that. So she was amazing, just really above and beyond accommodating for my blindness. Everyone else that I interacted with during my hospital stay, they were also really good. Like I didn't have any issues. I mean, she was like top notch. Everyone else was fine. I don't have any complaints, but also I wouldn't give them like a gold star. So anyways, I got hooked up to the monitors and they said I was actually already contracting on my own. My contractions were about 5 to 6 minutes apart. I was not aware of this because I had been having Braxton Hicks contractions for weeks, so I was just kind of used to them. And I'm also just very used to having stomach pain. That is just part of my life. So to me, just kind of felt like a regular old Thursday. And so they told me I was contracting on my own. So I was like, oh, well then can we not do any induction right now? Can I just hang out and see if things pick up on their own. And they said yes. So then I kind of hung out, bounced on my birth ball, got into different labor positions and did that for a few hours. And then I think it was about 9:30 a.m. that they said, you're not really progressing. We kind of need to get things moving along. So at that point, they started me on Pitocin, which helps bring on contractions. So at that point, then my contractions were coming like 2 to 3 minutes apart, and they still weren't really very painful to me. They just kind of, I could feel them, but I wouldn't say that I was necessarily in pain. I was just kind of hanging out. Like I said, no stranger to stomach pains. It just kind of felt regular to me. And so then they kept on turning the Pitocin up and up and up and up and up. Same thing. It wasn't really that bad. And then everyone kept on commenting on how I must have a really high pain tolerance, which was something I've never heard before, because I have lived my whole life thinking I had a particularly low pain tolerance, because I didn't know that it was just anxiety rather than my pain tolerance. So I was handling those contractions like a champ. I actually, at one point, I was just sitting in the hospital bed in one of my labor positions, watching Friends on the hospital TV, and I said, this is boring. Like, I'm bored. It was not what I was expecting. But that was short-lived. Around 1:50 p.m., my water broke on its own. And then it was not boring anymore. Things went from 0 to 1,000. I could definitely feel the contractions at that point. They were extremely painful. It was very difficult to be able to breathe through them. So at that point, I went into the labor tub, which was nice. And so this is not a birth tub. I didn't have a water birth. They don't allow that at a hospital birth. But it's to help with pain management, kind of like you might get into a hot bath if you have period cramps. So I got into the labor tub. I was in there for probably an hour, I would say. And then they had me get out of the tub because the monitors weren't working anymore. And also I was getting hot anyways. So moved back to the bed. And at that point, like the pain was terrible. It was feeling unbearable. And I was like, I can't do this anymore. And I was about to crack and ask for some kind of pain medication, which I had kind of been thinking about over the past, I don't know how long. It was all a blur. It's hard to keep time when you're in that moment. But I had been thinking about asking for some type of pain relief, even if it was just like the nitrous oxide. But it was so hard to catch my breath in between contractions. I couldn't even ask for it. But at the point that I was like, I cannot do this anymore, they checked me and I was ready to push. And I at that point, I didn't think, oh my gosh, oh no, it's too late to get pain medicine. I was the opposite, and I thought, oh, good, it's almost over. And I did it. I made it through the whole labor without pain medicine, and now it's almost done. I can do it. So I started pushing, I think, around 3:15 p.m. So it wasn't even an hour and a half after my water broke. So the very painful, intense part was not that long. So started pushing and pushed for maybe 20 minutes, I think. And then my baby was born, and that is our story. So like I said, it was pretty straightforward. I did accomplish my natural childbirth. I'm amazed that I accomplished childbirth at all, but I'm even more amazed and just feel really proud of myself that I was able to do it unmedicated. And no shade at all to people who do it medicated. This is not a commentary on anybody else and how anyone else does it. This is just how I feel about myself and my experience. That just, like I said, my whole life I have thought I have a really low pain tolerance. Like, I'm such a wimp. I'm such a baby. I can't handle anything. So to be able to do this, I just felt really proud of myself. And I was thinking that like the whole time I was pushing, I was like, oh my gosh, I'm actually doing it. I did it. So that was really nice. As far as blindness related things that I said I was going to talk about, one thing is, so when I was doing my birth plan with my doula, there was an option, I guess people do this, to use a mirror to see your baby's head crowning. Obviously I cannot see that because I can't see, but I was not upset about that. It was not something that I had any interest in seeing at all whatsoever. No, thank you. But also there's an accessible version. If you are a blind woman and you want to do this, there's also an option to touch the baby's head while it's crowning. Again, I was not interested in that. Absolutely no thank you. But if that's something that you want to experience, know that that is an option for you. And also, I have always said that I think for me, one of the biggest perks of being blind is that I cannot see gross stuff. And so, big silver lining is that I was not able to see any of the birth mess that was everywhere, which Ethan gave me a brief description of, there's a lot of blood. There's a lot of stuff that comes out. It gets everywhere, gets all over the floor. Sounds really gross. I am so glad to have been blind in that moment and not be able to see it. But there's a huge downside to that, which is that I was not able to see my baby when I had her. At all. I cannot see my baby at all, but I was not able to see her in that moment that, people are just, that is like the moment of a lot of people's lives, is when they hold the baby up and people see their baby for their first time. I did not get that moment because I couldn't see her. They put her on my chest immediately, so I could hear her. She was crying, and I could feel her. Honestly, she kind of felt like a fish. She was kind of like warm and slimy and like super wriggly. She felt like a fish, and I think not being able to see her affected how I felt in that moment. And I'm not saying that this is how all blind women feel, because some may just like feel that instant magic moment when they hold their baby for the first time. I did not, and I think there were a lot of factors going on. Of course, there's hormones. There is like, I was coming off of the most intense thing I had ever been through in my entire life. It was extremely painful. It was exhausting. It was very intense. Also, when they put her on my chest, it was not over, because I did still have to birth the placenta, and I also did have to get stitches as well. So my hard work wasn't done, but when it was all said and done, I just wanted to curl up in a ball and cry, because it was just hard. Like, it's obviously very physically hard. It was mentally hard. It was just a lot, and I wanted to curl up in a ball and cry. And so I just was not feeling all warm and fuzzy. And so I don't know that I would have even had that magic moment, even if I could see my baby, because I just don't know that anything could have been a magic moment with how I was feeling at that point. But I did, as soon as I birthed her, the first thing I did was turned to Ethan, and he like took my face in his hands, and he was crying like a baby. And I felt instantly better, because I felt like, okay, he had that magic moment. And so I'm so glad that he had that, even though I didn't. And that made me feel a lot better in that moment. But I do, to be 100% honest, I think not being able to see her did kind of affect our bonding at the beginning. And again, this is not the same for all blind women. I'm not saying that because you can't see your baby, you're not going to bond with them or you're not going to have that magic moment. This was just my experience. And like I said, I think there were a lot of other factors at play too. And I do plan on talking about this more in a future video about how not seeing her and being a blind mom kind of affected our bonding, but it was a bit of a slow burn for me. And that's okay. Like, we don't have control over our emotions like that. We don't have control over our hormones. And so I just want to like normalize feeling that way, not just for blind moms, but for any moms, for any parent. Sometimes it is going to be a little bit more of a slow burn, and that's okay. Now it is like full blazing. I am obsessed with my little baby. We got there. And then something else I wanted to touch on, which I've mentioned in a previous video, was my fear of encountering some kind of nurse, doctor, hospital personnel that had concerns about me being a blind parent and calling CPS and me getting my child taken away from me. And you may think, okay, that's dramatic. That's not going to happen. It does happen. It does happen. It has happened to blind parents, and it is absolutely despicable and also terrifying. And so I was afraid of that. I wouldn't say it was consuming. It was just kind of like a fear in the back of my mind, but obviously that did not happen to me, not even close. Everyone that I interacted with was really great. No one seemed to doubt me or be concerned about me being a blind parent at all. I did have one postpartum nurse that I got the vibe that she was maybe a little hesitant in the beginning, and I don't remember what she said or did or asked, or I really don't remember what it was. But I did get the feeling that she was like, I'm not sure about this. But then she seemed to come around, and I didn't have any issues at all. So that was really relieving. I think it was helpful that I came into this experience extremely well informed. I am a person that really likes to research, likes to learn, likes to be informed. I am a Ravenclaw, so I did a ton of research on pregnancy and childbirth and babies and breastfeeding and like everything. And so I came in knowing my stuff, and I think people really saw that, which helped them see me as a very competent and capable person. I think they could see that, even if physically I may need a little extra help, or it may take me a little bit longer to do something or to figure something out, I mentally am like 110%. And I'm not saying that all blind people need to do a bunch of research because we have to like prove ourselves and justify ourselves. I'm not saying that you need to do that or that we should have to do that. I'm just saying I would do that anyways, whether I'm blind or not, because that's just the kind of person I am. But I do think it was really helpful for professionals and probably my OB as well, dating back to when we first started working together, that all these people were able to see that I am an intelligent and capable person, and that because I'm very well informed, I know what I'm doing, and I can, problem solve things that I may have issues with. And then also a note on postpartum, because the birth isn't really over once you give birth. There's that postpartum period, that recovery period. For me, it was pretty rough. I did have a very painful delivery. I did have stitches, so I did experience quite a bit of pain afterwards. So I had to have like a little extra help, just kind of like maneuvering around. And Ethan did a lot of baby care tasks while I was recovering. I don't think I changed a single diaper in the first 2 weeks other than my own. So he was really good to have kind of like stepped up and taken on some extra of the load while I was caring for myself. But also they tell you, so postpartum, you have a lot of bleeding. That's normal for everyone. And they tell you to keep an eye on it, to look at the color and the amount and the size of the blood clots to make sure that it's what it's supposed to be and that there's not any issues. Well, I can't see those things. And so I did have to have Ethan occasionally check my bleeding, which you may think is gross, but that's what we needed to do to make sure that everything was okay, especially because right after I delivered, they were concerned about the amount of bleeding that I had. And so it was something that I felt like was really important to keep a close eye on. So I did have to have Ethan's help with that. I also had to, at one point, have him look at my stitches because I was experiencing a lot of pain and was worried that something was wrong with them. And I think a sighted person could use a mirror and look at it themselves. Maybe, I assume. I don't know. Maybe not. But I had to have him look at that too, which I'm sure, was not pretty. Was not fun for him to do. So I hope for anyone that's having a baby, but especially if you're blind, I hope you have a very helpful and supportive partner, and that, the your intimacy level is so much so that they are okay checking your bleeding. I hope so. If you're having a baby with someone, I hope that they are okay with looking at your bleeding to make sure that you are safe. And, I have to just take a second to brag on Ethan because he really, really is the best. He was so supportive and encouraging and helpful and caring and just all the things throughout this entire process, through our infertility journey, through my pregnancy, through the labor and delivery. He was right there the whole time, was everything I needed during postpartum. He was so helpful and just really stepped up to take care of the baby, to take care of me. He is great with Lila. They are so cute together and he loves her so much and just takes great care of us, but then is also really patient with me and helping me figure out, how to do things as a blind parent. And he just really is the best. So like I said, I hope for anyone out there who's having a baby, I just hope you have a really great partner because that's important to have. And one more piece of advice, kind of getting on the tail end of childbirth, talking about, transitioning from the hospital to home is, and of course you can take this or leave it. If you don't want to do this, that's fine. Everyone can just do whatever feels right for you. But something that felt right for me was to really limit and space out visitors. So I didn't have anyone come to the hospital when I was in labor or when I was delivering. We only had visitors after I'd been moved to the postpartum room, and we just had our parents the first day. That was it, just parents. We didn't have a whole host of people. And then my sister came the next day, and our parents did come back. That's all the visitors that we had in the hospital. And then once we got home, we really spaced out and limited our visitors. And I think that was really helpful because I was exhausted. Like I said, it was intense. I just kind of wanted to rest, to bond with my baby, to recover. I didn't want to entertain a bunch of people. And then once we got home, it's overwhelming learning how to be a parent and take care of a baby. It's extra overwhelming to do that when you're blind because we do have to do things differently and figure out our own way of doing things. And it's a lot at once to try and figure out and problem solve and practice and get used to learning how to do all those things. And so I was really overwhelmed at the beginning, and it was helpful to not have a bunch of people coming in and out, especially having people watching me struggling and trying to figure it out. So if that is something that you think may be helpful for you, don't worry about hurting people's feelings. You are the most important person in this equation. If you are the person giving birth, you and your baby and your partner is what matters. And so don't worry about hurting people's feelings. They may be upset. in a caring way, because they want to see you and they want to see the baby, but do what is best for you and for your mental health and for your new little family. So yeah, I guess that's all I have to say about this topic. Next time we can just like really jump into all the baby stuff and mom stuff. So if you have any questions or anything else you are curious about my childbirth experience, you can leave those in the comments. I'd be happy to answer any questions that you guys might have. And if you have any topics that you'd like to see me cover in the future about blind parenting, being a mom, my baby, anything like that, if you have questions, topics, whatever you would like to learn about or hear about, leave those suggestions in the comments as well. I'm definitely interested in making content that you guys want and that is going to be helpful. So let me know, and I will see you guys next time.